control pill makes the doctor's lives easier and the patient's lives worse.
I am an obstetrician gynecologist who went to school for 13 years only to be called a Band-Aid dispenser by an endocrinologist on your favorite podcast. I think this take was just as classless as it was lazy. What exactly does an endocrinologist do all day? They treat hormone-driven disease with hormones and hormone-modulating drugs. Hypothyroidism, levothyroxine, thyroid hormone. You got a prolactinoma? I'm going to give you a drug that suppresses prolactin hormone. And newsflash, ain't nobody out here calling your levothyroxine a Band-Aid because it treats but doesn't cure Hashimoto's. And I know you already know this, but I'm just going to remind you that replacing, suppressing, and or modulating hormones is literally the way to treat hormone-driven pathology. Gynecologists are physicians that, I'm going to argue, know the uterine, ovarian, pituitary axis pretty well. And a lot of these pathologies use the same playbook. Endometriosis is estrogen-driven. Suppressing that drive is going to manage the disease. It doesn't mask it. The only thing it's masking is the severe cyclical pain that patients are getting every month. For PMOS, what does the pill do? The pill suppresses androgens, and it also protects the endometrium from hyperestrogenism. In other words, it actually helps to prevent endometrial cancer. That's cancer risk reduction, not a Band-Aid. Heavy bleeding, PMDD, adenomyosis, dysmenorrhea, all hormone-driven processes. They are hormone-responsive conditions, which means we treat them hormonally. So when an endocrinologist suppresses the thyroid axis, it's medicine. You're a hero. You're Superman. But when an OBGYN does it, it's a Band-Aid. It's lazy. My sweet friend, that is not science. That is called a double standard. Studies are showing now that a lot of these posts on social media are driving people to discontinue their contraceptive methods. And the predictable result is unintended pregnancy, which, as we all know, is not harmless. I'm not out here judging you for giving your type 1 diabetics insulin. But your take, which clearly disregards simple pathophysiology about conditions that you probably don't understand, was not it. I'm sorry. Love you, mean it.